Roger that. OR is prepped and ready. Do we need to go up?
Not if I can rotate this posterior shoulder. All right, there's the elbow.
Make sure it's flexed.
It's flexed. Good call.
We're getting closer. Just stay with me, okay?
I'm trying.
Okay, I've got control of the hand.
Oh, that
Arm.
hurts.
Rotating the posterior shoulder up and out.
Fuck.
Perfect.
They're right there. Give me one good push.
Yeah. Good. Hey, we got a baby boy.
I've got a stubborn set of twins upstairs, admitted to postpartum. Congratulations, everyone.
Yeah.
Wow. They really went for it.
Yeah. So aside from the fact that they're doing this very impressive demonstration of a live birth that's taking place in the emergency department,
Right.
which is not what we want.
Yeah.
You know, I went into emergency medicine not to deliver babies, although unfortunately we do sometimes for people who have either a lack of obstetric care or, you know, are just in labor and happen to end up in the ER and can't make it to labor and delivery. But it's something that we try to avoid just because we're not as trained as the OBs are, you know, obviously in that care.
Yeah, I think this is one of the conundrums that you often have as an ER doc, which is that, you know, it's a part of your training to be able to do pretty much everything if you have to, especially when it comes to issues that could become life-threatening for mother or baby in this case. And so you have to make these decisions often on, you know, can we wait to get them to the operating room, or do we have to do the incision here? And we've seen that in other episodes, but I think this is another interesting example of that, and a scary one at that.
Yeah, that's exactly right. And it might be worth spending a minute talking about EMTALA, the Emergency Medical Treatment and Labor Act. So every emergency department in the United States guarantees emergency care for any patient that walks in with a life-threatening condition, and also for someone who's in labor. That's where the labor piece comes in. And so sometimes we're put in the position in the emergency department that if a patient is in active labor, they might not be safe to move, you know, to either move upstairs to labor and delivery or to go to another hospital. And so we are obligated both legally and in terms of patient care to deliver the care that we can, and in some cases deliver a baby where the mother is.
Yeah, no, and I think it's worth mentioning that not all hospitals that have emergency departments necessarily even have an OB department, right? I've worked in some areas that are very rural, and even the availability of services there is so low that it's not there. So it's either it's a transfer or you're doing it there in the department.
That's exactly right. And it emphasizes why it's so important to have really good prenatal care. And I think there is a misconception that some people think that they can walk into the emergency department and they'll deliver the baby and, you know, have expert treatment either from an OBGYN or from an ER doc, because, you know, they know how to deliver babies, and we do to some extent, but it's not our specialty. We don't do it every day. And so, yeah, that's why it's so important to be able to get to where you get an appropriate level of care and not wait till the last minute where you might end up somewhere where you can't get that level of care.
Right. No, I think we're often in this position where, especially today, with the way that what we view as healthcare in this country, which is that a right that everyone should have, and we really prioritize the idea of having choice and being able to go to like a high quality provider. It's one of the things that I think we have to often wrestle with, where, like you're saying, you're trained to deliver babies and you could deliver a baby, but we're in a moment today where we have the privilege of saying, let's try to minimize that chance of having a complication.
Right.
And then you're especially when it comes to technical aspects of care, which is pretty much anything procedural, we want to try to move that into the most experienced hands as possible.
Yeah, that's exactly right. And when complications occur, especially during childbirth, that can be a really tough situation if there's no obstetric care available. For example, there's a complication called shoulder dystocia, where the shoulder basically gets stuck and the baby can't come through the birth canal because that shoulder is stuck against the mother's bone. bone there. And so sometimes that needs to be resolved with an emergency C-section. And so if you don't have that capability at a particular hospital, you can end up in a really tough situation. Again, we're trained to deal with those sorts of emergencies, but just because there's training, it doesn't replace, the definitive care that's available potentially at a different hospital.
Yeah. Yeah, no, I think that's right.
Cool, let's keep rolling.
Good job.
He's pretty quiet.
Sometimes it takes him a minute. Put the baby on a pulse ox and a heart monitor. Hey, Amy, swap out with me.
No, dry and stimulate.
Vigorously.
Very vigorously.
Shouldn't he be crying by now?
Heart rate is 95.
Too slow.
Such Collins BVM.
Tiny volumes, once per second. This kid needs oxygen. Let's breathe.
Section ready?
Ready.
Dr. Ingram?
I'm opening the intubation tray.
Yep.
1 minute APGAR is 3.
Isn't that grass supposed to be 9 or 10?
What does that
Come on,
mean?
baby, breathe, baby, breathe.
There we go.
That's good, right?
That is very good, very good. Okay, you got this?
Yeah, go.
Looking much.
So it looks like they needed to do some neonatal resuscitation here. Show's taking place ostensibly at a big academic medical center. Like, more realistically, in a hospital with multiple specialties in the building, you would have pediatrics at bedside, potentially even neonatology, and you'd have the OBGYN team there as well. Like, this has now been going on for a couple of minutes, and it seems like the emergency department team is just kind of hanging out there. Again, because we lean on our specialist colleagues for that specialist care in these types of situations. That being said, again, if you're in a rural setting where that specialty care is not available, yeah, I mean, this is within the scope of practice of emergency medicine, and what they're doing there is the right thing. They're going through the neonatal resuscitation algorithms and trying to get that baby to start breathing.